Welcome, my friends, to Benjamin the Wise Guy. Benjamin the Wise Guy. People call me Benjamin. So I'm Dr. Ben, and I've been away for some time. 2 days is not. It's not a. It's a long time. 2 days is a long time, and I'm back. Guys, I'm back. I'm back. Sometimes you have to take a break, and when you take a break, you feel nice. You feel nice. Everything becomes all right. Because every little thing gonna be all right. Welcome, Jamaican uncle. Please don't worry about the day. Because every little thing gonna be all right. So I'm here, guys. Taking a break is a good thing at times. Taking a break at times is a good thing. It makes you be refreshed, and it makes you feel so happy to see you back, Dr. Benjamin. Thanks a lot, Uncle. Thanks for your compliment. Thanks for your compliment, and every other person that is here in the chat. Thanks for everything that you've been doing, watching. Queen texted me, and we talked, and those that were texting concerned about where is this guy? Why is this guy not coming online? Why? Why? It's because sometimes work related issue, and yes. So welcome to the chat. We were talking about headaches last time, and we went through some facts about headaches, and people are so confused about issues that. Let me clean this lens. About issues that we discussed, and you see, some things when you get to discuss them, people understand them well, and now people are understanding even some headaches. I don't need to take drugs. Some things you don't need to take drugs. You just need to manage them. Please share. Remember to like, subscribe, and share the video. Once a big up Jamaican uncle for always being there for me, man. Yeah, coffee cakes. Coffee cakes is here. It means coffee cakes too. Sometimes being away from your family and community is a big. Yeah. Look, Shat Ramels is here. Everyone. I was singing because every little thing, gonna be alright. And then you say, man, please don't worry about the name. So yesterday in Kenya, people are commemorating heroes, and it was mayhem everywhere. Police throwing tear gas. There were some people that went for a demonstration a day like yesterday, and like Dan, thank you, Shad Ravens, big up always. So when they went for demonstration, they died while demonstrating, and yesterday was commemoration, and the commemoration was with other demonstrations. So many people, yesterday it was like a holiday. People didn't go to work in Kenya. Some others are even held up in police stations even right now. But life is life, politics is life. Even politics was there before. So I'm okay right now. I was not feeling well, I told some of you, but right now I'm healthy. You see, I feel good. Yesterday I slept. Fatigue is no good thing, man. But I took some medication, and I'm good right now. I'm healthy and good. Everyone, let me shout out my family, man. Shout Travels, coffee cakes, Jamaican uncle. Happy say, Jamaican uncle told me, please give me a call, man. I want to listen to your voice. Something must be happening, and you are just there not telling us what is happening. Uncle, look. I'm good. Coffee cakes, you say, you good, eh? You good? Nice, nice, nice. Always there for me. So it has been like that. Some mayhem yesterday. People had to stay at home. Although I stayed at home, chilled, took some meds, and I'm feeling better today. And I've not come online 2 days. People have been seeing me on the chats, sometimes when you are at home and you see someone online, you have come, watch, and interact, and feel good sometimes. Family is who you care for and who you are with. I'm so happy to join you, Dr. Benjamin. I'm cool, and all the others in being monetized. Wow, look that one. Yes, that is what we want. Monetization as we grow. I'm so happy to join you, Dr. Benjamin, Jamaican Uncle. I'm cool, and all the others in being monetized. Uncle, you hear that? You hear that? Some celebration loading. Shah Travels loading. And can you listen to the Russian song Blood Type? It's sung by Korean singer Victor Choi. Victor Choi. Your name, I can't spell it. I can't spell your name. It is written in Russian. I can't read Russian. So subscribe and let's get going. I'll play it on Feel Good Friday. So congratulations, Shah Travels, on hitting your hours and monetization. Big up, big up, big up. Now the journey has started. After monetization, there is something called having the hours on point, and also having the views on point. You can have so many views with no hours. So let's get going, Sha. Let's be practical now and be tactical and be artistic, so that the people can come and we hold hands, So true, Shah Travel. It's good up to you every time. Thank you. Heading to 4,000 watch hours now. Yes. Cool. Some people tell me at work, even at home. I have so many friends that sometimes I just want to watch them in public screens and home. But I tell them, watch my friends. My friends are good people. You see how they talk to us, you see. One day I had put Margaret in Norway's a video on a public screen in a hospital. And every nurse was asking, who is this sister of yours that every time you tell us, watch my sister, man, watch my sister. But you see, we are all brothers and sisters. One motive, one love, brothers and sisters. So the one that has said, I listen to Russian song Blood Type. I can't spell your name. I cannot spell it. I can't read Russia. So tell us your name in English, and then we shout out you and we big up. We say that you are cool. You are cool. So the topic of today. Listen, I've just been excited coming back and seeing my people like Coffee Cakes. I had not talked to Coffee Cakes for some time. Shah Travels, Jamaican Uncle with dog now. And I'm excited. I forgot even the topic of the day. The topic of the day today is secondary headaches. Secondary headaches is the topic of the day. We have finished primary headaches. Now we are coming to secondary headaches. How have you been, my? How have you been? How have you, Dr. Ben? The green looks nice. Hey, wow! Now I will do a green suit. Hey, Shah Travels. Jamaican Uncle knows I love green. When I see nature, I see trees, I feel nice. Jamaican Uncle knows that. Green is a good one. Thanks for your compliment. I love that. So how is everyone doing? My friends like Shah Travels is struggling to get the 4,000 Adidas. Shah Travels, no worry. I'm back. My campaign should continue. We have to hit 4,000 hours. We have to hit. Jamaican Uncle, you hear that? You hear that? Share Travels have to hit 4,000. Let's do something. Jamaican Uncle. Coffee Cakes. Coffee Cakes is also here. Coffee Cakes, how have you been? How is everything going on? How has been things, man? How has been things, everyone? For the 2 days. 2 days feels like a lot of days without coming online. Now, hey. So when you stay 2 days without seeing your friends and then you feel it, you have not. I'm connected to nature. Yes, I'm connected to nature. I'm connected to nature. And green is life. Green, without green, green is good. Green is money. Yes, green is life. We eat green. The oxygen comes from the trees. They balance the nature. Everything is green. They clean the environment by taking CO2 and carbon monoxide, and they produce oxygen. So the ozone layer is not depleted because of the green nature, and we feel good when we put it on. So guys, this has been a good, the resting day has been good, and it's had a car accident, taking care of that. No one hurt but cars, but very stressful dealing with, yes, car accidents. They are not good. Even if it is a scratch, it gives you stress. Sorry, Coffee Cakes, I'm so sorry about that. Very stressful dealing with the insurance, care, repair, plus was a new car. Imagine a new car being involved. There was a time my car had stayed in a garage for 2 months. I felt so stressful. Sorry about that, Coffee Cakes. Sorry about that. When you have a car accident, even if it is a scratch, it is stressful. That one I attest to. So guys, Jamaican Uncle, thank you so much for your support. Thank you so much for being there for us. We love you. Yes, Jamaican Uncle is the OG, greatest of all times. Jamaican Uncle, but we have to push the channels of our people like Share Travels, Coffee Cakes, everyone. We need to do something. They need to be monetized. They are always there for us. They are always there for us. Dealt with rentals and repairs yesterday. I think I had my first stress headache after all yesterday. Yeah, I understand you. Everyone who has driving license with a car understands it. It is very stressful. Insurance, rentals, what? Here in Kenya, before even insurance comes, you have to call police. Very stressful. I'm so sorry about that, man. I'm so sorry about that. So the topic of today is secondary headache. Secondary headaches. We dealt with primary headaches, and just a recap of primary headaches. We dealt with a migraine. They are divided. Let me just give a recap of what we did. Chris Mugaza, Chris Mugaza, Chris Mugaza, how are you doing? Are you in Kenya? Mugaza, if you call yourself Chris Mugaza, you are the, yes, the guy, the OG in Kenya here. Chris, where are you coming? Which country are you from? Where are you chilling at? You are watching Dr. Ben. Dr. Ben is a funny guy. Thanks, God is good. I just needed to be more careful and aware. No problem. When things are planned, Coffee Cakes, you cannot. Sometimes me put this. That. When things are planned, sometimes you cannot unplan them. God knows the reason. Chris Mugaza is from Kenya. So I know you like vibes. You like vibes. Anyone who is a vibes thing, yes, calls himself Mugaza thing, but now, those things are upgraded, and nowadays we are not. Gaza does not do what? Tolerate bad things. Positivity is always there. So Mugaza, subscribe to the channel, and if you have a YouTube channel, you tell us so that we can come there and also promote you. Mugaza, say that again. So Coffee cakes, I want to tell something about it. Wherever something funny happens to me, I always say that it's a transition from something that meant was not good, or it's making you it's making you do something better than that. Yeah. Done. Welcome, Gaza. Stay around and let's talk. If you have a question, medical question, or any other mental health question, post it to the chat. Let's talk. Youths are currently really struggling with life, like gone to school, no jobs, parenting. Young parents. Those are things that here we talk about them. Gaza, mental health, medical issues. Very important. So if you have any question that entails all these things, hit me up, man. Hit me up and let's talk about them. Let's try to help each other. There are so good people in this chat. Chat travels. Pin, please. Pin for which location or I'm in Kenya. I'm Dr. Ben from Kenya. Or which pin do you ask? My bank account pin. Or location pin or which pin, you are welcome. So Shark Travel, no worries, everything that happens God has a plan and it is for the best. So let's celebrate that you are good, you are never hurt. Every other thing is material can be fixed, and we thank God for that. We thank God for that. So Mugaza, I'm still asking about the pin. Which pin? You are welcome. Jamaican uncle says you are welcome. You are pin on YouTube. You are as in pin on YouTube. I don't understand which pin. My channel or my pin as in which? Or you want my link? My YouTube link? Someone help me to understand Chris Mugaza's question. Caris wants you to pin him up. You want me to pin your channel. If you have a channel, you share it here. I pin you, and then you get some subscribers. Or which kind? Okay. Or today I've come live and I'm not loading something, but it's okay. If you want me to pin you up, share your channel, I pin it so that people can come and see you. Caris, people can come and see you. If you have some good content here, people will follow you. Okay, now let's continue about the topics of the day. If you have any question and you've been there for some time, you've been thinking about the issues that we have been discussing. We have discussed so many things, and you feel like you want to ask a question. Don't say that we are talking about headaches, so you cannot ask. You ask any question that you have so that we discuss. The topic of discussion right now is secondary headaches. We discussed about primary headaches. You remember primary headaches? Migraines, clusters, tension type, and then we had trigeminal, autonomic, cephalagias. And I said that word is not a big word. Let's not confuse it. Migraines and clusters are the same, like sisters. Migraines, yes guys, let's support Caris. He's a new content creator. You have 73 followers. Oh, okay, Caris. Now a campaign. Put your DB here. Share your link here. Share your link, I pin it, and then we say you will be followed. Okay. Now we were talking about the let me have a recap of the primary headaches slowly, so that we can know about secondary headaches. Primary headaches come with aura. There is primary headaches are like the disease of their own. Nothing is bringing them. They just start for their own. And they are divided into how many? They are divided into 4. Migraine, that always people say I have migraines. Tension type, that one involves muscles and skin and ligaments here around the it doesn't involve mostly the brain and the neurology, the nerves. And then we have the tension type. The tension type. That one is the clusters, and cluster headache and migraine are like sisters. But cluster headache, it doesn't have auras. Migraines have auras. What are auras? Associations like vomiting, blacking out, seeing one dark side, nausea. Those are aura. And the same migraine has funny. The same migraine has funny. I'm looking at something there. The same migraine have funny way of producing itself. It can come without an aura or with an aura. So those ones are like sisters. Even trigeminal autonomic cephalagias. Autonomic cephalagias. They have what? Same as migraines. So let me explain what trigeminal autonomic cephalagias is. Trigeminal is a nerve. Autonomic is automatic. Cephalagias are types of headaches. So it just means how trigeminal nerve automatically brings headaches. How trigeminal nerve automatically brings headaches. You see? So that is it. And it's important to note that these things share each other's. One can start and then it includes the other. So those are primary headaches. And the other thing that is important when it comes to primary headaches is the nerves, the 12 cranial nerves. We mentioned 12, but the main important one is the trigeminal nerve. What are the 12 cranial nerves? I keep singing them. Olfactory, optic, oculomotor, trochlear, trigeminal. Number 6, abducens, facial. Facial, and then we have vestibulocochlear. You see, glossopharyngeal, vestibulocochlear, and then we have the other, which is called number 10, vagus nerve, and then we have accessory, number 11, and then we have hypoglossal. 12. They come from the brain and they make you do things, see, smell, sensations of the face. Like trigeminal nerve has 3 branches: the mandibular, maxillary, and ophthalmic, facial sensation, but it gives you headaches. So these are things that are involved. And when a nerve is damaged or it is having an inflammation, what does it produce that gives you headache? It gives you calcitonin gene receptor peptide, which makes you, it's like histamine that makes people cough. When you are undergoing histamine problem, hypersensitive people. For in the nerve, when the nerve is damaged, it produces calcitonin gene related peptide, substance P, and neuroquinin A. When it produces those things, now they are mediators of inflammation. The brain swells, the arteries swell, and then there is something called hypothalamic dysfunction. The normal clock of sleeping and waking up, the balance of melatonin that makes you sleep goes away. I'm still on primary headaches. It goes away. So the inflammation goes on, and then the hormone that makes you relax, that is called serotonin, has a problem. Now it is not there. It is oppressed. So what do? We give you an antidepressant to agonize the serotonin receptors so that it can come out and suppress the calcitonin gene receptor, suppress the substance P, and suppress the neuroquinin A. You see how things are? And you can do this by just sleeping in a dark room, avoiding noise and avoiding lights. When it is so much, when it is so much in what? When you have so much things you are thinking of and it's acute. You get me right? Very important. This is very important, my dear friends. That is about the primary headaches. Now, do you have any question about the primary headaches? Yes, if you have a question, my WhatsApp number that we use is always open. My other one is what is this? Let me just answer this one. Yes. So someone was asking again, yeah. So these are things you should synthesize, feel them, understand them, so that at home when someone is sleeping and wakes up with a headache, you know this is not a primary headache. When someone is saying, I've been away working and I've come home, I'm having a headache, you don't rush to buy paracetamol. You don't rush to buy Panadol or aspirin, Brufen. Doctor, when I'm in the sun too long, get bad headache, what will be the cause? Yes, dehydration, 1. Heat tolerance, 2. You see, heat tolerance. So that is called cluster headache because you are burning the head, the tensions, Yeah. Caris Mugaza is feel. Caris, I'm waiting for you to pin your I'm waiting you. Headaches can cause pressure from stress, but all types. Yes. So headaches, Sha travels, heat tolerance. Yes, intolerance. Heat intolerance. Your normal balance strips away, then the muscles and the nerves, they start inflammatory response. Headache can be caused from stress, blood pressure, all type of stuff, Dr. Benjamin. Yes, and that's where we are going today. Secondary headaches that comes from something else. What Sha Travels is saying is called secondary headaches. We have just talked about primary headaches and I was explaining how it comes. Yeah? You see how things are heating up slowly by slowly, feeling this one that gets to that one. Now, there is this thing that we call secondary headaches. Secondary. Well, secondary means brought after this. Secondary. This is brought after this. Secondary two. Like someone can say, this person has anemia secondary to kidney injury, because the kidney produces erythropoietin, a hormone which produces the red blood cells. So when the kidney is injured, what happens when the kidney is injured? The red blood cells cannot be produced enough because the hormone release is slowly. But here now we are talking about headaches. Headaches, my friend. Chris Mugaza is confused. Someone to help Mugaza on how to post the link here, to pin the link. No, where is Chris Mugaza? Welcome to the chat. Welcome to the family. Talk well with my friends. They are good people. I love them. I love these people because they make sometimes I feel nice. Everyone who is coming to the chat and is here watching me for the first time. This is Dr. Ben. Yes, Dr. Ben, but the channel is called Benjamin the Wise Guy. Check if you have subscribed. Hit the like button. Subscribe so that when I'm coming online, you get a notification. Dr. Ben is online. If you have a medical question, ask. If you want to talk about any mental health situation, on Friday is the day where we talk about mental health situation as we feel good, all types of vibes. And for me, I love music, man. I love music everywhere I do. I do music. When I talk music. And you see, even like I'm talking, you can feel like I'm performing a poem. A poem. You see. So let's live with peace and harmony. That is my slogan. But welcome every person who is watching. If you are new to the channel, come to the chat and tell us where you are watching from. Tell us if you are watching us from the US, from the Russian countries, from the African countries. This is a channel of everyone all over the world. One people, different colors. Hey, one people, different colors. Yeah, nice people, different colors. Nice people. Someone from Jamaica, here from Kenya, someone from Gambia, you are from US. We can say it again. Nice people, different colors. Nice people in my chat. I love them all. Good people. Please like and subscribe. Let's learn as we feel good. Someone has just texted me telling me you are watching and you're not chatting here, but you can chat me at the WhatsApp and tell me, for real, I missed this guy. Hey, your teacher was taking a nap for 2 days. Let me answer him. Sometimes I feel good when people tell me these things, even if they are afraid of chatting to them. Fiona from Uganda. Today you are looking so nice on your video. Yes, I'm fine, Fiona. I know you've missed me for some time. How is your Onyx going on? Fiona, how is you and Onyx? When is your wedding? Guys, Fiona is a lawyer, is a student lawyer. Nice, Jassy. Everyone is telling me now, it's time for World Cup. Thanks, Fiona. Everyone is telling me nice, Jassy. Nice one. We're talking about secondary headaches. Now, I'm answering someone who is telling me. Now, let's talk about secondary headaches. I was saying Fiona here is a lady from Uganda. I would like if you go check out Fiona's channel. A nice lady, respectful lady. For the Genies that are there right now, I really admire her. Her hard work, how he takes care of the family, how he works out her things, school, and school. If you are being a lawyer, you should have integrity and dignity, and that is what is displayed to this young lady that is called Fiona from Uganda. I wish all the students that are here could follow how Fiona does her things. Now, secondary headaches. Let's talk about secondary headaches. Secondary headaches is a headache that occurs as a symptom and not as a primary problem. Another underlying condition. Unlike primary headaches, such as migraine, tension type, and cluster headaches, secondary headaches have an identifiable cause, which may range from mild sinusitis, inflammation of the sinus, to life-threatening like meningitis and hemorrhage. Those ones are primary headaches. Those are primary headaches. There's someone who is calling me here, calling me. Let me see. Okay, I've seen someone is taking care of the person. Now, secondary headaches. Let me put it in a clear the way we can advise. Like, you are having a stomach problem, when you're having a stomach problem and you have headaches, you ate some, when you had a bad day and you have headaches, you ate something, start diarrhea and you have headaches. When you're having let me say like a hypertension and you have headaches, that is secondary headache. It's headache occurring as a symptom, like if you have bad food, you will start feeling nausea and so the nausea occurs as a symptom. Now we have classification of headaches, of these secondary headaches, the classifications, just like we had classifications of primary headaches. Here we have classifications of pin, please. Shah Travels, okay. Pin. Anyone who can help me get their links here, it will be okay. Shah Travels is saying pin, please. Okay, let me try. Let me try. Go to channel. Let me try, because it's important. Let me try to get the pins. Let me try to get the pin. The problem occurs if you have edited your channel's credentials, you cannot get the pin. Oh, for Fiona, I've got it. Let me get this. This one is for Fiona, that one is yours. Now let me get, if I can get for Chris Mugaza. Chris Mugaza, are you a musician, or what kind of content do you do? Let me check. Oh, Mugaza Mugaza does several things here. Mugaza does things like let me check. Mugaza does things like what are they called? These ones are AI. They are AI videos. Mugaza does AI videos and also likes to dance. I can see Mugaza dancing. Click the message, choose the pin. Good evening, Dr. A. Stan's Kitchen, how is the going? How are you doing? Stan's Kitchen? How is everyone, and how is everything where you are? I've missed you, although we've met on some channels we chat. I've pinned Fiona's link and Mugaza's link, so follow them. Like Dan, Stan's Kitchen. I saw you cooking something today morning, although I did not follow up. The video was just running while I was busy. What was that? Please remind me. I put your video and then following. I'm a singer. Let's sing together. Ghetto Youth Happy. Which songs do you like, Chris Mugaza? I'm doing well today, dear. Thanks a lot. So we are talking about the secondary headaches. Classification of secondary headaches. Headaches attribute to trauma or injury to the head and neck. Secondary headaches have classification. So the first class is headaches attributed to trauma in the head or neck. And trauma of the head and the neck. There are how many? 3. Concussion, contusion, and compression. Compression, by the way, there is a video that will be premiering at night. It has explained these things so well. Compression, something is growing inside, or fluid is building up and compressing the brain meninges. Contusion, something has hit you and has gone inside and it has damaged the brain. Concussion, you've hit somewhere, there is no damage in the skull, but the brain itself has been injured because of the tension. It was Beans and Puffy Achombo. Oh, Mandazi. So Mandazi in your language is called Akachombo. Okay, Akachombo. Now, you see, that is it. Concussion, skull fracture, intracranial hematoma, wheel splash injury, cervical spine trauma. I'm going to sleep. Chris, if you are in Kenya and you are sleeping right now, that is a big problem. Well, this is no time to sleep, Chris. Now, the first thing I've said, let's classify head injury attributed to neck and head. That is first secondary headache. And then we have head attached, headache attached to cranial or cervical vascular disorder. Let me explain. That is the second one. Headache attributed to cranium, the cranium is the head, and cervical vascular disorder. Hello. T-Beauty, welcome. T-Beauty. T, did you watch that cartoon that was called The Bold and the Beautiful, or was it a series? The Bold and the Beautiful. Now we have we have started by categorizing secondary headaches. First is headache attached to trauma, injury to the head and neck, compression, contusion, and concussion. The second one, we have headache attributed to cranial or cervical vascular disorder. Cranial or cervical vascular disorder. This says vascular, the blood vessels, arteries and nerves, and veins. If they have a problem like bleeding and then you start having a headache, that is second categorization of secondary headaches. I think we are going so well. I'm doing it so well. T-Beauty, the Bold and the Beautiful. T-Beauty, have you seen that? Now let's talk about something. Ronnie. Hey, Ronnie Hassan, Ronnie man, Ronnie big man, Ronnie Hassan. Where have you been all this time, man? Where were you? Chilling and relaxing. There was time I was in your channel. I don't know those machines what they do. The ones that you are with. I couldn't comment. I couldn't follow up so faster because I was in a very busy place. But I saw you online and I just followed to see, but I couldn't. Ronnie, welcome. So the second one is, the first one is brain damage, the skull and the arteries. The second one is headache attributed to cranial or cervical disorders. And then we have another one. We have the other one which is headache attributed to non-vascular intracranial disorders. Compression, like if something is growing in your brain. I really wanted this topic, someone called Marcia Thompson. Yes, if you have Marcia Thompson number, please tell Marcia Thompson I'm online. Let me find Marcia Thompson. This is very important. Marcia, you know, is called Marcia Thompson is called Elaine, and we have Marcia Lifetime, which is still Marcia. Hi, Marcia, your topic is on. Is on. So, people, my guys, how have you been, man? How have you been? Sometimes missing your people for some time is funny. You start feeling like there is something wrong you are doing. Like when for the 2 days, I was kind of like feeling, yes, I'm so fatigued, but I'm doing something wrong. Why am I not going online? Why? And then I remember, even if I come, I will not talk like I'm talking. So, welcome my friends, welcome my people, You all look good. Ronnie Hassan has said, everyone hello. Shat Travels here, T-Beauty, we met on someone who is very funny. David Omaje. We met there, was it yesterday or the other day? When you go and listen to that guy, the first thing you start doing is laughing. Now, let's talk about the categories. Categories of secondary. This is an overview. Yeah. T-Beauty, you have connections with Shah Travels today. Yes, follow up. Now, secondary, let me go slowly. I'm just speaking so fast. I'm speaking so fast. Primary headaches is like a disease of itself. Nothing brings it up. Secondary headaches, they come as a symptom of something. They come as a symptom of something. So let's talk about these secondary headaches in another style, in this style of Dr. Ben, so that people can understand. These medical terms are killing us, and they are just things. You know, these are our bodies, and our bodies doesn't understand medical terms. Our bodies doesn't understand medical terms. They understand how to be okay, you know. So let's not talk about medical terms. Let's talk in a genuine way, the normal way. Secondary headaches. Headaches that are brought because something wrong is happening somewhere. So if something wrong is happening somewhere and a headache is coming out, what do we say? What do we talk about it? Headaches they are categorized in 3 types. If you injure your head, maybe trauma or something, or wheel splash when you are moving and then you do your head here like this and then it hits. It doesn't hit, but it suddenly stops. You have a head injury. That is a head injury. That is head injury and neck. Sometimes you can have headache injury. You know, there are some things that can do, like cervical spine trauma, wheel splash, intracranial hematomas, tumors, all those, compression, contusions, all those. That is first categorization of head injury and headaches and head injury, because all these traumas bring headaches. So it is secondary to something, you know. So we go the second category, which is headache attributed to cranial or cervical vascular disorder. What does that say? Headache attributed to cranial or cervical vascular disorder. You have a headache because there is an artery that is bringing problems, an aneurysm, or sometimes you can get ischemia. Ischemia is lack of oxygen. Guys, if you have any question, you ask. If you have any question, you ask, and we continue connecting as people are connecting. So you can have ischemia, blocked cerebral artery. A blocked artery in your brain can make you have a headache because oxygen is not getting enough. And those ones are common. Clots, you know, they are common. They bring headaches, you know, they are common. This is the second type, attributed to cranial or cervical vascular damages. Now, we have intracerebral hemorrhage, bleeding inside. That one is still the same. Vascular damages, arteries damages, intracerebral damages. And features, you know, when one artery like this one, let me show you. An artery like this one you are seeing here, these ones. If one of them breaks and it starts bleeding to the brain, what do you think will happen? If one of it breaks and it starts bleeding to the brain, what do you think will happen? What will happen is we'll start having nausea, compression, because the olfactory trigeminal nerve, the glossopharyngeal nerve, they are being compressed. You'll start feeling nausea, vomiting, and the vomit will be protruded because it is coming from the nerve. Reduced consciousness, you start feeling like you are not there. Your high blood pressure will come out. You see, high blood, sudden headaches. So headaches come in because of this thing, breathing. That is the second type of classification of headache, you know. We have subarachnoid hemorrhage, usually rupture of cerebral aneurysm, subarachnoid below the arachnoid matter. There is something that is called arachnoid matter in your brain that it can bleed. You can have stiff neck. You have seen some people when they are unconscious, they have stiff neck and they get stroke. It's because of the subarachnoid bleeding. Sometimes you cannot see well because all the cranial nerves that I've named are being compressed. So, like optic nerve, cranial nerve number 2 cannot see well because it is not perceiving well sensations, for loss of consciousness always. You have seen some people having loss of consciousness when they have, and they need to get stroke, Now, giant cell arteritis, inflammation of medium and large arteries. When your arteries get inflamed, usually affects people that are 50 years. When the arteries get inflamed, what happens? When they get inflamed, what happens? You lose consciousness, temporary headaches, because they are still producing some substances, endothelins, nitric oxide. The nerves are still compressed sometimes. When the nerves are compressed, you start having problems producing the mediators of inflammation like calcitonin gene receptor peptide, which is inflammatory. Yes. Marjay, greetings Dr. Ben and everyone. Marjay is here. Marjay was one of the people that was looking for me. What is happening to Dr. Ben? Why is he not coming online? Marjay, today I'm okay. Thanks for your concern. When someone is concerned about you, you tell God thank you. You tell God thank you for it. Because there are some people who never care about others, There are some people who never care about others, But we thank God. Thanks, Monday, for your concern. We thank you. Where were you, Doc? I searched and searched. Yes, I was feeling some here, there syndrome. It is called Hapanapale. In Kenya, we call Hapanapale syndrome. It's like you are sick, you are not sick, you are not okay, everything is down, but we call it here and there and here, around the world syndromes. But I'm okay right now. You can see I'm okay, I'm feeling better. So the 2 days I've not been okay, but right now I'm fine. Now you feel special. T-beauty. T-beauty. Sometimes when it's not a feeling of feeling special. No. It is that feeling of saying, thank you, God, for giving me people that at times they care about me. That feeling of security, feeling of social security. Now T wants to glad to know that you are doing better. Thanks. Now T wants to make fun of me. T, I know you want us to till the end. So we are introducing secondary headaches today. It's a large topic. Oh, stop it. We are introducing something that is called secondary headaches today. And you see, the things that I'm saying is not an easy topic. It is not an easy topic. It is a very large topic. This one is far more bigger than the primary headaches, Secondary headaches, because they come because of something else. And those things are many. So we might go and go and go, and you may ask so many things. Monday, I'm doing good and hope it's well with you. Monday is good. Monday is good. Monday, is everything good on your side? Yes. Now, those are things that we have said. Let me repeat. Beauty comes in and pokes me a bit, and then I lose direction. Let me come back to direction. Headaches attribute to classification of headaches. Headaches that are attributed to head injuries, like concussion, contusion, and compressions. Those ones are the first class of headaches. Then let's go to The second class of headaches are headaches attributed to association factors like vascular disorders, like the, yes, doc, but Jamaica is very hot. Oh no, rehydrate, my friend Marty. Cranial, attributed to cranial or cervical vascular disorders. Cranial and cervical vascular disorders, those headaches are doing what? Are the second type of headaches, like blocked cerebral arteries. You'll get ischemia because of stroke. Ischemia is lack of oxygen. Okay, intercerebral hemorrhage, bleeding from the cerebrum, hemorrhage. Yeah, you will have compression and you will start having nausea, vomiting. That is the second type of headache. You know, you see that? Oh, I've seen something. So that is the type of headaches that we are talking about. Let's talk about something that is called there is something that is called subarachnoid bleeding, arachnoid matter. There is, after the skull, there is an arachnoid matter, bleeding inside the arachnoid matter. You see, that is another big problem. And it is sudden. You know, it is sudden. Let's talk about, here it's thunderclap. You hear like your head beating, you know, vomiting, photophobia, loss of consciousness, all that. And then you have gigantic cell arteritis, inflammation of medium and large arteries. They cause headaches. Those ones we will learn about them. Cerebral venous sinus thrombosis. Thrombosis is the thrombi, something that occludes inside the veins and stops blood to flow well. You know, all this we are going to talk about them. And here we will talk about things that bring, like oral contraceptives, pregnancy, cancer. All those we will talk about them. So let's talk about attributed to non-vascular intracranial disorders. That is the third classification. Non-vascular attributed disorder, like brain tumor, something that is brain in the brain. That one is the third one. You know, that one can cause a headache. The fourth one is headache attributed to substance overuse and withdrawal. People that like alcohol. People that love alcohol, cocaine, you sniff it until tomorrow you don't understand yourself. It is Chwea. It's Chwea. How is the going? It's Chwea. How is everything in Qatar? You know, it's Chwea is another friend of mine that is a good friend. It's Chwea never leaves me behind. He's always telling me, big up, bro. We go on with this work. You know. You see, so it's Chwea, Dr. Ben here to support you. Thanks, it's Chwea. It's Chwea, when are you coming back home? You know, when you meet your homie online and then you are friends and then, you know, it takes so long. You kind of like start asking, when is this homie of mine coming home so that we link up? So it's Chwea, tell me when you're coming home, man. Yeah? It reminds me of everything should be alright. Oh baby, hold on, everything should be just fine. It's Chwea. You have to sing that to your person. If you left someone in Kenya and you are in Qatar for 2-3 years. This person of yours always sees you on the screen chatting only, and they're saying, we miss you, I miss you, you better sing for your person. Yes, I know that you miss me, baby. Yes, and then if you have children, you say, and I know the children too. Hey, just imagine. It's not easy for a man to live this way. And this is why I'm saying, oh baby, hold on, everything will be just fine. If you know that musician, pin that musician here so that we can know. I'll come home east west. Home is the best, doctor. Yes, home is the best. But seeing that if you left someone in Kenya, your person, your empress, your girlfriend, when you are out there, don't let them miss you so much. Give them a tune and tell me who sang that song. If you know that person, hey baby, hold on, everything should be alright. Yes. So we are introducing this topic that is called secondary headaches, and I'm just introducing it. From tomorrow we are hitting the road, stepping on it one by one. So guys, which type of headaches do you know under secondary? I know you understand now what primary headaches are. Primary headaches are very funny. There we have talked about nerves, we have talked about several things. I've given even what nerves produce that makes your brain get inflammation. You get? And now we want to talk about this thing that is called what? We want to talk about this thing that is called inflammation of the outer things and headaches that are produced not from the nerve and the brain itself, but other things that are contributing. So there are 4, and those 4 we have said are headaches because of substance abuse. If you've been gone for years, don't think they moved on the next one in the line. Better forget about it. It's hey, but you should, you see beauty, but you should let them know that you are always there for them, You should let them know that you are always there, You are always on time, always on, And that's why I'm saying, for those that live away from their people, let's get them singing for them. Tell them and reassure them. Make them believe that you are there always thinking, I'm thinking about you. Girl, I miss you. Seriously. Baby, ever since that day you went away, I still think about you. Oh baby, girl, you're always on my mind. Shona Paul and Daville, always on my mind. If you want to listen to that tune, search for Sean Paul and Daville, always on my mind. And then the ladies, some other ladies told us, you are always on time. Get on time. Tell that person I'm here for you and I'm still thinking about you. I've been thinking about you. Oh, yeah, this real world, yes, it's a real world and the world is real. So that is it. So I've just been introducing these topics, so that people can get to know which topics we'll be going through this week and what we'll be studying this week. We have talked about headaches attributed to substance and drug overuse. Substance and drug overuse. Doctor, I check on my family every day before I check anyone on the internet. True man, you are a big boy, I say. I say that again. Tell them. Swear, that is it. I check on them and sing for them. Oh baby, hold on, everything should be just fine. Yes, I know that you miss me, baby, and I know the children too. I'm still asking who sang that song. Someone to tell me who sang that song. If you know who is that guy, hit me up, my friend. Hit me up, my friend. Tell me what you think. Tell me. I know I give you tunes that are so good and fine. Tunes that are good and fine. So, as a recap before I end, I want you guys to know that this week we will be dealing with secondary headaches. And these are not mental headaches. You know, mental headaches are even stress can give headaches. You know, stress can give you headaches, and when stress is giving you headaches, it's a bad thing, because you have to deal with some people. I'm giving some insights here, and some people are giving me tunes in the background. You see, so you have to do what? You have to know how to manage to differentiate between primary headaches and secondary headaches. Now, we were talking on some things here, and it's an introduction. And you know, our last born T Beauty always like making jokes, and T Beauty is a beautiful lady, and even in every house, the last born is the one makes people laugh every time. So last born. Yes, big up every time. We love you, and we are talking about now secondary headaches that occurs as a symptom of something else. Here, we want to talk about headaches attributed to substance or drug overuse, like coffee. If you take excess caffeine, you will get headaches. Nitrates, carbon monoxide. Have you ever slept? Hey, Eversy, welcome, Eversy. Thank you for tuning in. Have you ever been in a room full of charcoal that is burning, and then you stay with it, unventilated room? You will have bad headaches. And if you want to die silently, stay in a room that is not good ventilated and put there charcoal that is burning for overtime. Man, you will not wake up in that sleep. Cocaine, bad things like coke, alcohol is not good. Alcohol is not good. Let's talk about hydrocephalus. We have talked about headaches. Hydrocephalus is a compression, compression. It's more fluids compressing the brain. This one talks about headaches attributed to non-vascular intracranial disorders. Non-vascular, the nerves are good, the blood vessels are okay, the veins are okay, everything is okay, but there is something growing inside like a tumor. And something like hydrocephalus, fluid piling up in your brain, it causes headache. And then there is something called idiopathic intracranial hypertension, pseudotumor cerebri, hypertension. Those people that are obese, you get most people that have big bodies and their weight is way above, BMI is not matching up. They often have a headache, and sometimes visual obstruction. We'll talk why. We will see why. Why the big bodies have problems. Hydrocephalus, we have talked about it. Hydrocephalus is when the brain is producing cerebrospinal fluid. When the brain is producing cerebrospinal fluid, the absorption is not there, but it keeps on piling and piling. So the fluid inside becomes so much. So that is it. Now let's talk about something else that is called headaches attributed to vascular disorders, cranial and cervicular vascular disorders. Those are headaches that are attributed to something like the veins, the arteries, and the nerves. You see, so this is not a small topic as per se. As I introduce it, it's not a small topic, So that is it, my friends. Introduction. I had missed people so much, and I hope everyone is doing fine. Now, anyone who has a question, any medical question, let's talk about any medical question. It's not a must that we talk about headaches now. Let's talk about any medical question. Yesterday, some people were having problems in that in Kenya, after the tension, tear gas, everything that was happening yesterday, and people were throwing stone. Today they are lying down in cells, police station cells, and some are having headaches. That is type of headaches, you see, brought by trauma, So those are things that we need to talk about. We need to talk about and know how to go about them. We need to talk about them and know how to go about them. So everyone who is in the house, thank you for tuning in, and I hope primary headaches, we did them so well. Primary headaches, and people are asking questions about these primary headaches, how they come, and secondary headaches. I think we will go with them so nice. For the 2 days or 3 days that we have not been okay, hope everyone is doing fine. Hope everyone is doing fine, and everyone where you are chilled there, and you're watching Benjamin the Wise Guy. If you want to avoid headaches mostly that come by themselves, headaches that just grow by themselves, you have to stop having stress. You have to stop having stress. Stress is the facts that gives us stress in life are the facts that we as people, we are not given the balance. We are not able to adjust the balance of life, because as things become hard and harder, we need to have the adjustment of life. When things happen to ourselves or our families or anyone else, we need to have the balance of life. But the problem is sometimes the balance of life is not there. That's why you start thinking. And sometimes even, I usually say things are funny, in that when you have what you have, you think everything is not enough. You want to go to the next level, and the person who is next level wants to go to the other level. There is a book in Kenya, poetry that was written. It was called Walenis. I wish it could be written in English so people could read it. So stress is the most common thing that happens when a person is having headaches and stress and tension. Because stress and tension, when you are undergoing some things like heat intolerance, you see, so hot, you are being dehydrated. Sometimes you release stress hormones, and when you release stress hormones, what do? When you release stress hormones, you know what you do. The brain itself now starts to create, to come up with problems, So 75% of people that undergo stress is because of headaches, is because of stress. And even when you are sick, when you are sick, when you are sick and you are there lying on the bed, or you are home, you can't do your jobs well. Sometimes when sickness comes with stress, you start feeling that I'm not okay. I'm not okay. So you are releasing stress hormones, and the stress hormones are giving you inflammatory responses in the brain. And when you are releasing inflammatory responses in the brain, what happens? Very many things happen when you are releasing inflammatory responses. Like, you start having, stress hormones like adrenaline. They constrict the blood vessels, constriction, and they make the nerves to produce now the things that I talked about. The funny things that people don't, they say that those terms are very complicated. Even the nerves are living things. So when they are excited, they bring some other things. So when they bring those other things, what happens? You start having the response, the normal stress response, and you start having headaches. You are having dehydration. Maybe you have a bad stomach. You're having dehydration. If you have a bad stomach and you are having dehydration, what will happen? You will have headaches. It is called hypovolemia. And when you are diarrheaing, acute diarrhea, when people are having acute diarrhea, what they undergo is stress. Imagine you running to the loo every time. So the hypovolemia itself brings headache, and then the mental health part also bring headache. So you see how these things are interconnected. Moments with Keisha. Keisha, welcome. Moments with Keisha. Hope you're doing well wherever you are. I was introducing some topic for the week the topic is called secondary headaches. So right now, I'm just having a random talk before I tune out. Yeah. So those are the things that we undergo. But symptoms of a disease, mostly, like most of the complications that people have in life is headaches as the first symptoms. Headache is the first symptom that shows up to tell you, my guy, you are not doing good. And for secondary headaches, these are the things that you'll be looking. Let me name them. Let me name some of the things that show up with headaches. You see, let me name some things that show up with headaches as a symptom. Vomiting, nausea, vomiting, when your abdomen is not okay. We have things like fever. You feeling feverish. That is another thing. We have some things like neck stiffness, knuckle rigidity, like in meningitis. You have seen people that have meningitis complaining of headaches. Those are secondary headaches, altered mental status. Sometimes someone becomes confused, drowsy, some agitated, and it reminds me, someone asked me a question. Why is it that when someone is convulsing, this person wakes up and can start doing things that are not normal, like beating someone up, like sometimes throwing things around. You see, it is because this person is in a state of confusion after loss of enough oxygen in the brain. But after some time, this person balances. Increased intracranial pressure is a very bad thing. ICP, increased and stroke. Let's talk about seizures. Brain tumor, stroke, brain abscess, encephalitis, head injury, all those, they can cause seizures. And you see, these things cause headaches. We have visual disturbances. Sometimes when you are photosensitive, you are at a place and you are looking at some places and you cannot even open your eyes like this, called photosensitivity. It is a problem because it ends up to be a headache. It is called head tumors. You see, let's talk about something that is very important. I'm looking at someone is texting me a very important question. That one I'll answer it tonight. Head injury, visual disturbances, weakness or paralysis. Sometimes paralysis, if your arm is weak, your legs are weak, and facial weakness, you can start having a problem. You can start having a problem with headaches. You see, you can start having a problem with headaches. Speech problems, headaches associated with tumors, abscess. You can have pus in the brain. Sometimes a part of your brain or part of the associated substances in the brain can start having, they can start deteriorating, and in fact something that is dead somewhere, and then it rots, and then you start having abscess. So you have fevers with headaches. We'll talk about them. And then you start having speech problems. You know, cranial nerve pulses, the nerve, the 12 cranial nerves that you have can start having problems. It is very important to note that the 12 cranial nerve have a bigger role in your body and the state of you having a good well-being. The 12 cranial nerves, they are very important. You know, papilledema, swelling of the optic nerve. I will explain it when time comes. When there is something that is called cupping, it should be 0.1, the size behind the eye. So when it rises and it's over 0.4, you start having headaches because you are compressing the optic nerve. Headaches. I'm talking about secondary headaches. You see, there are so many things that are involved when it comes to headaches. So many things. So those ones are things that we're going to talk about this week. Unless anyone has any question concerning our topic of today that I've introduced, it's important we see. If you have any question, I have 7 minutes before I go. Anyone with any question? Anyone with any question, my friends, who has any good question or any funny question? Funny questions makes us to laugh. Good questions makes us to learn. Funny question makes us to laugh. Good questions makes us to laugh. To learn. So anyone with good question that will make us learn again, or funny question that will make us to Desert Channel is here, my friends. Desert Channel, great to see you too. Where are you chilling at home? You know, here in Kenya right now is a cold season. And everyone is complaining. The cold is too much. Everyone is complaining that the cold is too much. You see. So, if you are here and you're feeling cold in Kenya, big up. You do what? Put on well and keep warm You know, put on well and keep warm. So I can see Jamaican Uncle, Desert Channel, Stan's Kitchen, Moments with Keisha, all of you, and T Beauty, it's sure all of you, Majay B that have been here, and Chris Mugaza is our new guy. Chris Mugaza is our new guy here today, and thank you for tuning in, Chris Mugaza, Stans, Share Travels, everyone. And see, we continue hitting up, and I'll continue bringing these topics because I noticed some people are getting help from random topics. We are having the heat over here, Dr. Benjamin. Yes, heat. When you're having heat, the best thing to do is to rehydrate and stay away from, if you have skin problems when there is heat. Today we are sign of rains here in the village after a long time. Oh, okay. Even Nairobi, I can see it's very cold. Let me look out. I can see outside it is like cold. So that is it, my friends, and all of you here, thanks so much for tuning in, and it is cool having my friends around. For those that are at hot places right now, rehydrate, stay away from the heat. Stay away from the heat. Use sunglasses and skin products so that you cannot get the burnout. You cannot get the burnout. Skin can burn until you start having skin conditions that you are not having. That is very great, Desert Channel Explorers. Please make a video from it when it started. Yes, I like rain because when there is rain, you feel good. The green comes out. So for Desert Channel, make the videos, man. Let's see it rain, but let's see it rain. Let's see your place looking fine. Yeah. I'm just asking if anyone has a question before I leave. I've been here for more than 1 hour, and you know my time always 1.5 hours, unless we have a long list of questions. Okay, let me see here. These ones that people are asking in my inbox, those ones they will wait. They will wait. Those ones they will wait. So let me see. If you have a question, post it before I log out. I have 2 minutes to go. Today. It was just introduction. Do you always deal with dental issues? No, I'm not a dentist, but I can advise because I have technical know-how. So if you have any question about dental, I can advise you. But I'm not a dentist. I'll just advise and then we'll go see your dentist. I'll just advise and then we'll go see your dentist. Okay, I can see some questions coming in. Those ones I will not deal with them right now. So guys, as you come in, what is the question about the dental dentists deal with the gums, the gums and the teeth, and sometimes around the oropharynx region, but that's not so much. They deal with issues about the oral region. So Desert Channel, what is that question? Or if it is a refer that I can help you get a good refer. Dental issues are broad. I can just give an overview, but dental issues are broad. Dental issues, they go up to something. I need some of mine replaced. You want to put some add-ons or stick-ons or what? Or you want artificial teeth? The advice to that is good when you see a dentist to check the state of your current dental, how your oral region is, the gums, and then to advise which type is good, because you can have stick-ons, you can have permanent, and they differ from size. They differ from quality, not size, from quality. And it's important when you want to replace your dental unit, especially those ones that are depleted. It is very important to check on a dentist for advice. But if you have been having pain and halitosis, halitosis means bad breath from your mouth. The first thing you need to do is to take care of the bad breath by taking medication, antibiotics. Antibiotics, if your gums are infected, you take antibiotics, you take some mouthwash to kill the bacteria, because even the dentists themselves, they cannot do what? They cannot get into your mouth when it is infected. You have to. I once got hit by a donkey while making a video. Oh no, sorry about that. See, Desert Explorer, see a dentist, and let the dentist evaluate the tooth that were destroyed, and then after evaluating, the dentist will talk about it. Will tell you the best way to go. Because some cracks just need refilling, but it's the permanent damage that is bringing even the tooth to have problems. We do replacement, and that is the work of a dentist. Unless if it is a problem that you want me to try and explain, that one I can. But for dental cases, see a dentist. That one is advisable. But if you have a cracked tooth and gums that are bleeding, and you have halitosis, bad breath in the morning, and sometimes even if you brush your tooth, there is no help, the bad breath is still coming, just know you have infection. You need to do what? You need to take antibiotics of choice by your doctor, and you will be helped. So that is it, my friend. Maybe anyone has the last question. I think my time is done. And I will meet you. There is a premiere that will be there at 12 a.m. Kenyan time. You can go through it. It's about headache, and there are important tips about headaches. So you can get help from there and get something so that you can, headaches make some people go fatal. So you guys have a nice evening and enjoy. I will consult a dentist. Yes, please consult a dentist and enjoy where you are. Enjoy Desert Channel. If you don't find a good dentist, ask me. I can give you some contacts, and you get help. So my guys, I have to go now. My time is away by 5 minutes. Enjoy everywhere you are and be blessed. Love you all. See you at midnight 12 for the premiere. Bye bye.